My name is Dr. John Klimkiewicz. I'm at Washington Orthopaedics and Sports Medicine. I'm a fellowship-trained orthopedic surgeon with emphasis on sports medicine with a subspecialty interest in biologic knee preservation. Some of the surgical procedures that are done include ligament reconstruction, meniscal repair and or replacement, and cartilage repair and or replacement. From a ligamentous perspective, I think the community is very well in tune with ACL and PCL reconstruction, but there are some new techniques that have, let's say, come to market that are even looking to repair what we used to replace. And some of the outcomes to those techniques seem promising. When it comes to the meniscus, we're looking to repair it as compared to trying to, let's say, remove it, because with removal, certainly the risk of arthritis tends to increase over time. And in cases where it has been removed from a surgical perspective, there are even techniques to replace or, let's say, transplant a cadaveric meniscus in the place of what was removed. Cartilage transplant or repair is a very broad technique, which includes, let's say, very different techniques that can start with a microfracture, where you're trying to stimulate the underlying bone to produce a more, let's say, durable cartilage when it's absent. And there's also cell-based therapies where we actually transplant one cells or transplant even allograft cells actually into one's knee with the hope that we can regenerate one's cartilage. Paramount to any type of cartilage regeneration type of technique is looking at the biomechanics and looking at how stresses are imparted to the knee, because oftentimes that's what leads to the patient's problems from the beginning. And in those cases, we're looking at knee realignment, where we're actually straightening out the knee, or we're looking to, let's say, place stresses in areas that are more favorable to prevent knee breakdown. When you look at sports medicine and biologic knee preservation, that entails and encompasses a wide variety of the population. It includes your, let's say, high-end athlete from either a professional perspective or collegiate or high school level, but can also include your weekend warriors and your recreational athletes that include a lot of runners, include a lot of, let's say, golfers, include a lot of tennis players, where obviously the goals are somewhat different, but in some respects the same. Everybody's looking to maintain their level of activity. And in doing so, a biologic approach to the knee, where we're not taking things away or replacing them, has a much more favorable outcome. Depending on the approach taken, the timeline can be very quick when you're looking at, let's say, bracing, and you're looking at, let's say, physical therapy to kind of fine-tune one's muscular strength and equilibrium to fit their needs. But oftentimes, some of the let's say, more invasive procedures, one can be looking at somewhere between 6 months to a year to, let's say, achieve their goal. And I think that's real important when you look at these patients and you look at, let's say, the technique chosen, is to really have a discussion with the patient in terms of what truly are their goals. Because one technique doesn't work for everybody. And I take pride in my practice in trying to educate the patient and trying to give them, let's say, reasonable expectations when choosing this approach toward knee restoration.